What's going on, everyone? Today we are getting into exercise during pregnancy. So here's a quick little video going over chapter 3 for you here. So hopefully this isn't more than about 10 minutes for you. A couple things real quick. You should know a few different hormones that are going to come about from pregnancy. So human chorionic gonadotropin, or HCG, this is the hormone that gets released after you've had an egg fertilized for females. So this is what's actually detected in pregnancy tests. Estrogen and progesterone, those are two big hormones we have during not only just pregnancy, but really throughout all of post-pubescent female life. Estrogen's your biggest hormone you're going to have. It does a whole lot of things. In terms of pregnancy, though, it's going to help with your endometrial lining, and it's going to help prepare you for lactation. Now, progesterone is what you're going to need to help to maintain your endometrial lining during pregnancy. Oxytocin, or it may also be known as tocin, this is something that's going to start being produced really towards the end of pregnancy. You'll also, if you get like an epidural for delivery, labor and delivery, it'll usually have oxytocin along with it. This helps to not only produce milk, but it also helps to form a bond between mother and child. So it actually does a lot for that as well. Now, prolactin, coming from the word lactate. So this is going to be the hormone we need to get the mammary glands to start actually producing milk. So there's your brief rundown on your hormones there. Now let's look at a brief rundown at your trimesters. So trimester 3, so you got 3 of those. Typically your trimesters are about 3 months each. In the first one, your first trimester, this is where things are the most really chaotic. You can have huge swings in hormonal balances, in mood, in your overall physical feelings. So you can be have a lot more risk of, say, like having morning sickness during the first trimester. A lot of it's really because your hormones are really kicking into overdrive here. Second trimester, now your body's adjusting to these hormone levels. You're hopefully not going to see much nausea during this time. You will start actually seeing, though, you'll start showing the pregnancy. Now, in the third trimester here, this is where we're really settling everything in, getting ready for the actual delivery and birth. The big thing here is that as the fetus grows, it's going to push out the mother's organs, essentially. So especially like the bladder and your colon are going to be largely affected by this. Also, your stomach could be affected as well, which could potentially cause additional uric acid reflux. Braxton Hicks contractions, these are false contractions. So you can have these, and you do have these throughout pregnancy, but they're not an indicator of actual labor. So when you go through labor, you will actually start dilating your cervix to allow for the baby to pass into the birth canal. With Braxton Hicks contractions, these are contractions without dilation. So they do not lead to childbirth. There's a couple of prevailing theories on why they might happen. The kind of leading one right now is that it's going to help strengthen the uterus for actual labor and delivery. Another thing could be that these contractions are a signal that the infant or the developing fetus is not getting enough oxygen-rich blood, and the contractions help to deliver more blood to them. As you know, the other thing too that not really going to talk about too much, but the infant physiology. When an infant's born, they're about 25% muscle, so they have relatively, a lot of muscle, or sorry, relatively little muscle, a lot more kind of cartilaginous and really fat buildup, essentially. Placenta, this is just where the baby lives. Now, what's important about this is the actual sac itself, because this is where you actually get a lot of vascular supply to the developing fetus here. So you want to make sure the placenta does stay in good condition there. Now, some of these substances are pretty, pretty self-explanatory why you wouldn't want to have them. Listeria is actually a bacteria. This is of particular concern because if you do contract a Listeria infection, usually there's nothing wrong with that. But if it gets in your blood, it does carry a very high mortality rate, like roughly 20% mortality rate if you get Listeria inside your actual bloodstream. And that would actually happen as a result, or actually it would cause a condition known as Listeria. Listeriosis. There we go. Now, this here actually can be killed by alcohol, but you really don't want to be drinking alcohol while you're pregnant. Now, we have talked about how ACSM has all of our guidelines for exercise. Well, when it comes to pregnancy and exercise, though, ACSM actually defers to ACOG, which is the American Congress of Obstetrics and Gynecology. So ACOG is who actually sets the guidelines for exercise during pregnancy. For exercise testing, it's okay to do testing. You really only need to do max testing, though, if you have medical risk. Now, core body temperature. Every time you exercise, your core body temperature is going to increase. Now, that's okay. I mean, that's just normal for that to happen. When your body increases its core temperature, the thing that you want to look at here is that you can potentially damage or injure the fetus if their core temperature increases too much. So that's something to be kind of cognizant about. Every process, both anabolic and catabolic, that you do is going to affect your core body temperature by increasing it. Now, the interrupted blood flow to the fetus, decreased oxygen delivery to the fetus, this potentially could happen. It's not something that's too terribly concerning. However, this also is a reason why you wouldn't want to do really heavy exercise when you're pregnant. So it should be pretty light, relatively speaking. We'll see the guidelines later, like the actual numbers later here. Now, this was a previous thought, the increased risk of low birth weight babies. Infant birth weight is the best predictor of future health for the newborn. So the bigger your baby is, the better overall it is. The thought was that if you do too much exercise during pregnancy, it would actually cause low birth weight for babies because your body is diverting resources to you to support your increased energy needs during exercise that's taking away from the developing fetus. Now, this has kind of been not necessarily disproven, but there's a lot of contradictory evidence to it. So this isn't something that I really hold in a high regard, but it is something to be cognizant of. Now, you want to, after the first trimester, gain roughly about 1 pound a week. So you should, around about 30 pounds, be gained during pregnancy. If you have severe morning sickness, you can actually lose weight, especially during like the first and even in the second trimester. Circulation is going to be improved when you're exercising during pregnancy, always a good thing there. However, the big thing with it is we don't want to be doing max exercise. All of the regular benefits you get from exercise do still carry over during pregnancy. Now, preeclampsia is high blood pressure. If you're doing regular cardiovascular exercise, it can definitely help with reducing the chances of this. You don't want to have high blood pressure because that's not only going to affect the mother, but also the fetus as well. High blood pressure means that the mother's heart is working harder. And because you have a developing fetus in you, you're going to also have to put additional strain to support the fetus. So we do have to be cognizant of that. Now, here's where we got to look at with our actual prescription. Now, if you were sedentary prior to getting pregnant, you want to at least get medical clearance before you start exercising. You know, you would do this essentially if you went from being sedentary to being active, regardless of your physical status or your pregnancy status. Warm-ups, 5 to 10 minutes, pretty standard there. Now, you ideally want to be doing some kind of aerobic or cardiovascular training every day of the week, but you don't want to do that much of it. So do a lot more frequency, a lot lower duration. So 15 to 30 minutes, 40 to 60% of your VO2 reserve, 12 to 14 on the 6 to 20 Borg RPE scale. That comes to around about 120 to 140-ish beats per minute. So think about what kind of exercise you'd be doing that would actually cause you to have your heart rate go to about that 120 to 140 range. And that's about where you should be. Kind of goes without saying, but I guess you do have to say it. You shouldn't be doing contact sports or high impact sports. Not a good thing to say be playing tackle football when you're pregnant. Now, strength training, you want to do light exercises. So 2 days a week, maybe a little bit more, but you want to avoid increasing your intrathoracic pressure. So no Valsalva maneuver. Try to avoid the supine position. So you really don't want to lay on your back. That can adversely affect your blood pressure as well. If you don't remember anything else from the special considerations of pregnancy and exercise, just remember that you should avoid pregnancy or avoid exercise during really adverse or inclement weather, and stay hydrated. The more hydrated you can stay, the better it's going to do for you overall, not only for help improving a lot of circulation issues, but it's also going to help you with your overall core body temperature. So you have a lot better thermoregulation if you stay well hydrated. If you get any of like these contraindications, so if you have any of these symptoms of adverse effects happening, you want to stop exercising and seek medical attention. Now, for nutritional needs, I only want to briefly touch on this because it's not a nutrition class, but calories need to increase when you're pregnant. They also need to increase even more when you're lactating. So about 300 to 400 calorie per day increase during pregnancy, and about a 500 calorie per day increase in caloric intake when you're lactating. Folate is one of the major micronutrients you need during pregnancy because folate helps to prevent neural tube defects. Neural tube defects the neural tube is what will eventually become your central nervous system, so brain and spinal cord. Primarily, the biggest neural tube defect you run into is having spina bifida, where the spinal cord grows outside of the body. And that can largely be prevented by having folate in the diet. Now, this has 600 grams here just because this little symbol didn't carry over, but it's 600 micrograms there. I'm sorry, not micrograms, milligrams. There we go. All right, so that is our overview of pregnancy and exercise there. Just a quick one for you there. So if you have questions, we'll be going over this again when we come back to class. If not, I will see you all on hopefully Tuesday.